Two truths and a lie, Dr. Phil, bald advice dealer or trauma profiteer in a suit. One's fake. The rest are more real than his hairline. 1. Dr. Phil hasn't held a license to practice psychology since 2006. That's right, America's most famous therapist legally can't therapize a cactus. But that hasn't stopped him from handing out life advice like it's gospel, while wagging his finger at teenagers having meltdowns on national television. He's basically your uncle with a superiority complex, if your uncle had a soundstage and a teleprompter. 2. The Dr. Phil show has been accused of giving alcohol and drugs to vulnerable guests before filming. Because nothing says helping people like throwing an addict a bottle of vodka to really get the cameras rolling. There are rehab clinics with better ethics, and they're run out of strip malls. 3. Dr. Phil once opened a free mental health clinic for low-income families, paying staff out of pocket and refusing media coverage to avoid turning pain into promotion. Because, he's all about humility and not profiting from people's trauma. Just kidding. He trademarked his own name and sells self-help books like they're Girl Scout cookies for the emotionally shattered. Pick the lie. Then ask yourself, is this man a therapist or just the Jerry Springer of feelings? Answers. 1. True. He lost his license in 2006 and never renewed it. Doesn't matter, the brand's stronger than the credentials. 2. True. Multiple guests and sources claim production gave addicts booze and drugs backstage. Cue the "we take this seriously" PR statement. 3. The lie. There is no humble, media-free, Dr. Phil-funded mental health clinic. That's fiction. Because helping people quietly doesn't pay, as well as watching them fall apart in HD, between ads for fiber supplements. Dr. Phil didn't build a practice. He built a circus. And the trauma? That's just the popcorn. If you enjoyed this story, don't forget to like, subscribe, and drop a comment. It really helps the channel grow. Thanks for listening to Hidden Thread Teller.